Let's just talk about the purpose of data. There's a concept of high reliability in healthcare, meaning that you are monitoring events, activities, you're promoting a culture of safety for people to safely report events or near misses or things that could cause harm. So all healthcare organizations, have some sort of expectation around, especially those that provide critical care, around incident reporting data. It could be any kind of patient safety event. Data is so critical in that setting because you can listen to techs who work a floor and they have a valuable story, but often it's a story. But if you look at the data from that same time frame, then you can tease out, it's actually at 10:30 in the B hall that we probably need to put a tech because this kind of thing keeps happening. Or at this shift, the kids are just a little bit more, rambunctious. It's the witching hour, which exists in every home in America, right? So let's add additional staff at this time and maybe the incidence of these things will go down. So data, not only in business growth, but business operations, keeps your patients safe. It helps support quality. Patient outcomes are tracked. And that's why it's the expectation for organizations to track this.
Lydia, thank you so much for joining us today. It's great to see you. And, I was thinking about, as we were sort of preparing for this, I was thinking about the first time you and I met. And I want to tell you a funny thing about that, which is you and I met originally, I think, through the Apex guys. And we were talking about like a very specific tactical thing that we were, that they asked us to sort of have an opportunity to talk with you. And as you started to describe, and this was related to face Meta, basically, and thinking about how to make Meta maybe more efficient. But as you started to describe what all of the other components of the funnel and how complex this really is to make work, I remember thinking, I literally gulped because I'm like, I can't believe. And of course, we work with other healthcare, but hearing you describe, and you have an unusual situation because you've worked in so many different areas of the business, you understand the complexity, and it was quite daunting actually. And so I was, and you were very like, here's how it is, let me explain the facts on the ground. So I thought, wow, it's a difficult job to get it right.
Well, it's what I was saying to our friends at Apex, right? If there was an easy button, we would have hit it.
Thanks.
Nobody enjoys, having to try to pick and pull and tease apart what it means to make a behavioral healthcare organization run. Right. And it is complex because you're dealing with patients and, their medical and their psychological disposition. And so it is a very nuanced aspect of healthcare.
Let's start maybe with the beginning a little bit. You were boots on the ground. I mean, you were working directly with patients and so on at the beginning of your career, and now, you're head of development at ERC. Talk a little bit about what brought you to this space and what, and of course we've talked before about the mission in it too, but help me understand kind of how you started there and how you've ended up in this role.
Yeah, no, I appreciate that. I think, it starts with the fact that I'm a social worker. That's who I am.
Right.
So I do have my degree in social work, so my education, but then license at one point, and I did direct patient treatment for a period of time. But then as I moved through my own journey, I moved over into risk management, performance improvement within behavioral healthcare, took an opportunity to really do quality improvement for a while, some operations, and then landed in the odd and very geeky space of compliance for a solid 15 years.
Wow.
I really just love the aspects of compliance and helping people understand how to overlay what is required of us in against what we are doing already. In other words, it's not this big, bad, horrible thing. It's actually serves a purpose. And so I did that for quite a long time, actually, on my own. And I wasn't really looking to come back to an organization and move back, to Denver in 2020, so the pandemic. And I had a chance to meet the founder of ERC Path Light, who is a truly inspiring man. Dr. Ken Weiner founded this company and was a refreshing breath of, fresh air with his perspective and, unwavering commitment to the patient and the patient's journey. And, he had founded a company that was taking care of the sickest of the sick in a specific little niche market of behavioral health. The whole world of behavioral health is a lot. And he really was very committed to the patient journey, and then also recognized the need for mood and anxiety treatment. And hearing him talk about the dedication to these patients really just spoke to me as a social worker. And I thought, okay, it's time for me to maybe, take a different path. And I, joined the company initially as the chief compliance officer, actually, and then moved into development a little over a year and a half ago. And so it's really now about promoting access to care. So in my role now, I get to go back to being that social worker that really is an advocate and someone who breaks down barriers and makes sure that everyone has access to care. So that's kind of how I landed here.
One of the things that we try to do in All Dots Connected is talk about the particulars of the challenge of being able to provide that access and be able to scale the business, which essentially means you can reach more people and serve more people. Talk a moment about, given your compliance background, which, the good news about compliance is there's a set of guidelines and rules that make sure that everybody does this in a way that serves the patient properly and so on. But it also adds a meaningful challenge as you look at a lot of the types of techniques you might apply to be able to grow. Can you speak a little bit about how you guys manage that?
Yes, it is. It is a challenge. And thankfully, it's one that I think in general, society is a little accustomed to operating in, because healthcare in general has a lot of those same rules.
Right.
So your primary care physician, if you went to the dentist, the rules that govern a lot of patient privacy, patient rights, all of that is the same. However, it does challenge us in a marketing space, if you might imagine, around types of campaigns that we might deploy, and making sure that we are only reaching out to those members who have initiated contact to us in some way, shape, or form, whether it be through one of our continuing event activities or our conferences, networking events, or if they were referred to us by a provider. And within that messaging, you want that tone and tenor to be sensitive and individualized, but it can only be so individualized because that person's identity is, not known to us. And so it's really just trying to make sure that we are applying the right levers at the right time to engage our patients, within the rules that we are allowed to operate. Some of those rules also apply not only from a regulatory, state license and accreditation framework, but also our payer mix. And so we have different payers who are contracted with us, and we also have, to work within the confines or the articulated constructs of our contracts.
Right. So when you think about the challenges you've seen across your career, but particularly now in your new role, and you think about the types of challenges you've seen where, sometimes this can feel like pushing rope a little bit, right? There's so many different points in a patient's journey, and we're looking to find a way to be able to not only make sure they're providing the care as necessary, but also do it in a capital efficient way, such that we can provide the foundation for growth or driving more EBITDA, which allows the business to thrive and grow. When you're thinking about the types of things you've seen as you came into this new role, or elsewhere, anytime in your career, what kinds of things have you seen where, because of the complexity, it just wasn't getting where it needed to go, right? And what kinds of things what types of techniques and ideas did you employ to sort of figure out a way to be able to get unstuck, as it were?
Yeah, no, I think that's a good question. I think this is where being that compliance geek and a data geek comes into play. I think there have been times where I have seen organizations, whether it be ERC Pathlight or organizations I consulted with over the years, who apply a sort of a one-size-fits-all solution to their strategy. And rarely, especially in an organization that has a national footprint, does one size fits all work. And so this is where you have to tease out what is happening in a regionally, sort of responsive manner. And then you look at the data and what it tells you, and then you begin to tease apart by cross-section of who you're trying to reach, whether it's an adult patient population or a child and adolescent patient population. How are you trying to reach them? What is the tone and tenor in that region? I mean, we have organizations and facilities in the West Coast, and we have them in Texas. I mean, those folks inherently behave differently, both as the patient and the providers. And so really making sure that we use the data to inform the effectiveness of our campaigns and what we're trying to do. And so really being able to slice that at a more regional and local level allows us then to be more efficient and effective with our marketing efforts to drive demand. The clinical side of the house is a little bit easier. We always joke, if you do the right thing by the patient, if you provide the good care, the patient outcomes will tell the story and the patient will get better. And that has its own, if you build it, they will come. And so we like to keep that a separate conversation so that the integrity of the clinical program is measured and monitored, not by the patients that are in the beds, but rather by the clinical outcomes, readmission rates, our alumni support groups, what we hear from them. So that side of the house does their thing. And then our side of the house looks at what does that particular region need? And then how do we respond to that need?
So you guys found, and I think what we see this a lot actually, which is if your data systems and the mechanism, the resolution that you have on the data is not sufficient, you average yourself to death a little bit. I mean, it is about trying to find. I mean, you're talking about the regional example, and that's a really good one. But there's many of these, right? Which is that we're not sure what to do because we can't see the good news and the bad news clear enough. Is that something you've seen?
Correct. Well, and the good news can be masked by the bad news, and the inverse could happen. In fact, that very thing happened to us at one point in time. We had so much success in one channel that we didn't realize another channel wasn't performing because we didn't have that line of sight at that granular level. Data is valuable, but it's also super dangerous because first, garbage in, garbage out. If it's not clean, if it's not accurate, if it's not timely, you can't make an informed decision. And then the people who are looking at the data have to all be in alignment in terms of, what are the basic core principles of this data set. And then you have to be curious, right? You can get into analysis paralysis. I have sat here clicking through until I just step away from the computer, right? Sometimes you actually need to zoom back out. But I think more often than not, taking a moment to dive in is actually a very valuable exercise.
Yeah. We've definitely seen that. I think this alignment thing is another thing that we've seen also across many sectors. And I think it's been true with you guys as well at ERC, is the ability for, and you said it just right, which is that the data is right. There's data integrity. So everybody's looking at the same data set across a lot of different types of roles, that it just makes it, a lot more efficient to get the conversations to be productive.
Well, right, because we all know, right, there are roles that have intentional friction in organizations, right? And so you can get a marketing team pulling on an admissions team, pulling on an ops team, pulling on the discharge planners, rinse and repeat. And I think it's compounded for us. We work in the behavioral health industry. There's a lot of feelings. There's a lot of feelings in this industry. It's a great thing. And there are a lot of feelings. It takes, I think, a unique person who spends their career in this space. So data in some ways gives us Switzerland. It's neutral. It allows it not to be personal. And that still takes some coaching because, again, data can be misused and it can be manipulated to tell a story, which is why a common data set, data framework, and agreed upon vernacular is what actually eliminates all that noise. Because then you've all already agreed this is the truth. right? And so if you've agreed on that principle, it no longer matters if it's Sally or Jim or whomever's fault. It's no fault. It's what does the data tell us and what do we need to do? And that allows us to be more effective. Makes all that.
And that crosses over into finance as well. So you have the ability to be able to make this an investment decision, and work together to figure out the best way to be able to get the outcome.
Correct. Because if you just look on a balance sheet and you see the expense for the marketing department, we're always the culprit of the spending.
Right, exactly.
So you see the expense, the marketing department went up, fourfold or whatever it is. And then you're like, yeah, but you only got, 7 or whatever number of patients, let's say. But then the next part is, but those patients were at this level of care, and this was the ROI on that. And this is how effective we were in that spend. And so the cost per was actually X, right? So it doesn't become, oh my gosh, you're spending too much money. Stop. It's, hold on, let's look at what did that spend get us? And do we want to do it again, right?
Right. It's so interesting, that level of specificity, the ability to be able to cut that conversation off at the pass and be able to talk about an ROI that's abstracting away everything that's happening in marketing, is really powerful because then it's a productive conversation. We see this a lot. It's the curse of the biggest line item on the P&L, right? Like it's just, I don't know, can't we reduce this by 20%? That's the easiest way. And of course and the answer is yes, but.
And right, this will be the cost, right?
Yes, and right, exactly. This will be the cost, exactly. And you can start to see it. When you've worked and consulted for a number of companies at different sizes.
Correct.
So when you're small, it's a different problem, obviously. But when you're a size you guys are, where you have many, many locations, many regions, a very complex set of initiatives running. So we referral but also a variety of different channels where you're bringing clients in. Talk a little bit about that complexity and what that means as you guys think about how to be able to go from here to the next goal, basically, increase revenue and increase EBITDA.
Well, I think, again, this is the social worker talking.
Right.
Sometimes it gets in the way of the capitalist. Often it does. But I think they go well together because goes back to doing the right thing. I think you look at our country and look at the state of mental health care, period. 1 in 10 individuals have an eating disorder. Generalized, mood and anxiety disorders are across the world the most common diagnoses. We also have a known shortage of providers, psychiatrists, nurses, licensed clinicians. So the need, which is often the first question you answer if you decide to grow, is well established.
Mm-hmm.
The how, the where, the what, that's a lot more nuanced because, in the pandemic, it became, wildly popular to offer behavioral health care and healthcare in general virtually. And certainly we have offered that level of care because we believe it serves a need in a population effectively clinically. We also recognize that higher levels of care require in-person treatment. And so, taking where we have been, learning that we may need to offer different levels of care and different lines of service in different geographic locations based on need. And unfortunately, we are bound by a payer mix as well, is how we look at how we slice through growing. It can't just be, here's the opportunity, go. Like a lot of, growth initiatives are just opportunistic. And this has a real human element that we have to make sure we can adequately and appropriately service. And different states have different rules around levels of care and licensing, and even if you can open a program and how big it can be. And that goes all the way up to the federal government. And so teasing through all of that is part of how we decide to grow. And so we tend to take, the buckets and then, send folks doing research viability. We come back, we sift, we sort, and then we try again. And the example, that I can give you right now is in the state of Colorado, we were successful in the past year in finally being able to accept Medicaid patients here in Colorado for our PHP and IOP programs. And so that's great. The higher levels of care are a little trickier for us to tease through based on just some, older regulations that are from the federal government. And so we're working closely with the state Medicaid. We're working with the Red Sea Consortium and trying to provide more, government payer access to care. And so that's a growth strategy for us because that is a market we've not been able to serve. And so it's very complex. I mean, it's like you said earlier, it's not just, I want to go sell steaks over here. I have to go do all of these things in order to make sure I can help these people.
Totally. So another way to maybe say that, and it sounds, as I listen to it, is the product itself, which is this combination of how it's going to get paid for and what is needed in this particular place and what's possible,
right?
Given all the regulations, is in a lot of ways an evolving thing, right? I mean, so as head of development, obviously you're, intimately involved and of course know those sides, but do you guys have a process where you say, okay, great, or it's coming from where does that occur in the organization and how do we go, look, we think we have an opportunity here and it's this is what the service would look like and here's the patients and so on. Is that something that you guys are, it sounds like you're doing very proactively to say, okay, here's a new opportunity and then it comes over to the marketing side? How does that work?
I think it speaks again to the culture of the company. What I love is it's not just driven singularly by a finance person or a marketing person. It is just as likely to be my CMO or my local regional medical director who calls me up and says, hey, I heard St. Joe's is doing this, or I heard, Colorado Children's is doing this. I think we should partner and maybe we can reach these patients, right?
Right.
It comes from a place of service. I really do believe. And so, I spent some time in Seattle with our regional clinical director there, and she just passionately talked about, providing care up in that area and some of the challenges regionally that they have there, but what they want to do and how they want to do it and the clinicians in which, she needs to, support this program. And so it is a very organic conversation. I think we're a big company that still, I'm very thankful, feels small and accessible. And so we are open to all. We as a development team, obviously, and I partner very closely with our strategy team, we're constantly looking at the market from sort of an analytics standpoint, and all the things that you would expect would inform diligence around deciding to open a program. That's happening ongoingly, but it's actually the unique opportunities that you hear at the grassroots level that allow you to be much more effective in joining into a community and saying, we're going to partner with you, and how about you catch these subset of patients? We'll catch these, and we'll sort of, we'll work together. And so that really resonates in this particular field.
Yeah. Well, I mean, one of the things that I've always found very inspiring about spending time in healthcare generally, but certainly in behavioral health, is people who are in it. There's a mission in it that's incredibly valuable. And as you point out, people need care that they can't get or are not getting.
Yeah.
Right. I mean, the need far exceeds the ability for us collectively to be able to provide it. And, and people are focused on that, right? I mean, and it's a foundational component. Maybe say more about this idea. So what we find in businesses that are, I mean, this is a weird thing to say, but I think it's very similar. The fashion business actually has something, it has an interesting analog with behavioral health, which seems maybe on the face of it seems impossible, but it's a very similar thing in the sense that it is the people who are making the product are super passionate and it's not in any way related to the economics in a way, right? I mean,
it's related to the art.
It's related to it's related to this thing. And obviously it's, couldn't be more different in one sense, but it has that thing. But a similar challenge, I think, emerges when we think about those cultures using data So you've seen it probably a number of different ways. You know, maybe speak more about this. What happens if you don't have that common data set, and what are the kind of challenges for businesses in that situation, and what happens when you're able to add this a more sophisticated approach to data as it relates to what we call growth, but really is thinking about scaling the business.
Well, I think the danger is you make assumptions, and there's that whole adage about that. And so if you don't have the
Great.
data, it's risky to make an assumption and make an investment, whether it be a product line or service line, and you are not able to reach the clientele that you intended to, right? And so
Right.
it's just a riskier move. And I am risk averse, as which is not common in a development officer, but very common in a compliance officer. And so, I can't imagine, because there's a lot of investment in people when you
Mhm.
stand up a service line, right? We give people jobs. I mean, so there's a responsibility for them to be able to work. And so for us to not use data to inform the viability of a service line would just be really irresponsible.
Yeah. Do you find, I mean, across the industry, of course, you touch many different businesses. Are people, do people have sophisticated data systems where they're using, or do you think it's,
I think you have some Excel jockeys out there who do an admirable job with what they have. But again, remember we talked about having a common data source. So if you have a data set that everybody's pulling from, you could sort of with duct tape and string do it. I think it just depends on it is an investment, investing in your data infrastructure without a doubt, and the hygiene of that data and the how keeping it current and all of that. But I do think that there are unfortunately folks out there who may not spend enough time in the data and again make assumptions, and so it's just really critical. I think it's there. I mean, the data often is there, and so it's worthwhile taking a moment to just validate what assumptions are out there. I mean, whether it's in development or it's in quality improvement. Remember, I talked about how I'd spent some time in risk management and performance improvement. Okay, so let's just talk about the purpose of data just really quickly in that setting. There's a concept of high reliability in healthcare, meaning that you are monitoring events, activities, you're promoting a culture of safety for people to safely report events or near misses or things that could cause harm. So all healthcare organizations, have some sort of expectation around, especially those that provide critical care, around incident reporting data. Right.
Right.
And so it's a patient falls, it's a med error, it could be an allegation, it could be any kind of patient safety event. Data is so critical in that setting because you can listen to techs who work a floor and they have a valuable story, but often it's a story. But if you look at the data from that same time frame, then you can tease out, oh, it's actually at 10:30 in the B hall that we probably need to put a tech because this kind of thing keeps happening. Or at this shift, the kids are just a little bit more, rambunctious. It's the witching hour, which exists in every home in America, right? So let's add additional staff at this time, and maybe the incidence of these things will go down. So data, not only in business growth, but business operations, keeps your patients safe. It helps support quality. Patient outcomes are tracked. And that's why it's the expectation for organizations to track this. And so to go back, the reason this relates to your question is, I think more and more organizations are becoming accustomed to using data to drive their decisions. I just, then my worry is it the same data set they're looking at? Because I will still remember in way long ago statistics class I took where, my professor showed me how the same data can be, misused to tell the different stories. So the best thing that we can do is become good stewards of our data and then really good consumers of it.
and this is something also we see often, because of course we do, and across many sectors. Often the data and business intelligence around operations is actually in some ways less controversial. Like I would imagine there's nobody within your org or any of the works, no, everybody wants to make sure not only is it a requirement, but it's critical to be able to provide the care. Nobody's like, hey, we shouldn't have data around, incident reports, like, right?
Right.
But as it relates to growth, often the analytics are, and this is not just true in behavioral health, this is true across all sectors. It's in the queue, but it's slow because there's a lot of other demands for that team to be able to do it, and being able to understand what to do and it's, as it relates to growth, is a different problem. Maybe what I think would be fascinating to hear. First of all, do you agree with that? Does that make sense? And then I'd love to understand how you went through the process to advocate for and be able to get buy-in across the organization for a more growth-focused analytics approach.
Yes, I think, I was fortunate. ERC Pathlight had resources that not many of my other healthcare organizations I've worked with have had. They had a data analyst team. And I, was very fortunate to step into a team that we actually call her the Oracle. I mean, she's really that good, right? But she is a person. And, it is important, as we all know, there's a concentration risk. If you have everything all knowing and all being in one person, that's a high risk proposition. So I was fortunate that I didn't have to convince anybody that it was important to have analytics in this case for this company. I think in a lot of behavioral healthcare organizations, it's an FTE that is not always seen. I mean, sometimes you are picking between another floor nurse or a tech or a combination of those and, somebody who is, not clinical as an FTE. So I think that's a real challenge. However, I did not face that here. We were, though, managing our marketing efforts largely through, various complicated Excel workbooks that were pulling analytics from our data lake. We're looking at, our Salesforce data. We were looking at a lot of different things. And I think, really it was thankfully with some great support, from our investors that I was able to articulate the value of investing in a data platform and the associated team that comes with it. And I think that's part of it, right? Is you can look at the math, you can do the math. Trust me, we did. And how many FTEs could I get for this spend? And you could build it in-house. However, I think the sophistication of your data platform allows you to function in an equally sophisticated manner. And so it is time value of money. Do I have the time to build my own team, build all this up, or should I partner with an organization that has these capabilities in-house and has the genuine interest and intrigue? I think that was what was really nice, is it didn't really just feel like we were another client. There was some mutual sort of wins, right? And it was nice to win together with another team. And I very much so feel like we did. We learned a lot about the nuance of our spend. So remember, I talked about, just briefly that we treat eating disorder patients and mood and anxiety patients. Those two groups of folks operate very, very differently. They engage in treatment very differently. Their needs are profoundly different in terms of medical complexity versus a more heavy behavioral health intervention. And so how we engage in them in the market has to also be equally responsive. And what we learned was, where is our sweet spot of spend based on the nuances of how these subsets were responding to our campaigns? And so it became much easier to convince, I'm going to say, because I didn't really feel like I had to do too hard of a sell. I think I'm very fortunate again in that this leadership here, we are very collaborative, and I think the value in what we're able to see and do and learn as quickly as we can. I mean, that's just it. It's quickly, right? Being able to make decisions. I mean, moving a healthcare organization is like moving the Titanic. And so, quick is just not something that we do. And yet you have to be agile in the marketing and advertising space. You just have to be.
Right.
It's not a choice. We'll get left behind. And so, again, clinical programs are doing their things. And so we were having to shift and pivot. And this partnership allowed us to be much more effective while we were taking care of a lot of business in house.
Right. Right. So, what advice would you give a chief of development at another organization in this space who maybe doesn't have that, that has a similar commitment to the mission, but doesn't have the sophistication on the marketing side and on the funnel side? What advice would you give that person to how to broach this and figure out how to get buy-in? Because I think even in your case, it still took work because every dollar counts, right? I mean, it's so. How would you recommend? I mean, you've seen a lot of different types of organizations, but how would you recommend they think about that?
Well, that's tricky, because so much of it depends on the dynamic at the leadership level and who holds the purse strings, right?
Right.
So for-profit organizations that are PE-backed have a different level of flexibility with their spend than a not-for-profit who has to tie dollars back based on a state or governmental budget, right? And so it's a little trickier. In either case, the accountability that you are able to hold to your team is much greater when you are in the data and you can prove things. And so I think it would be more, I would engage with them with a lot of questions first in terms of how are you currently doing it? What level of detail and line of sight do you have into your ROI? How do you know things are working or not working or are working, but if you did it better would result in a threefold, fourfold increase in, inquiry volume? I think it has to start there. And then I think I would want to understand how they're held accountable and how do they measure success? Because, I could go on and on about how great this is, but it's for me, it works. I have the disposition, I have the sort of, like I said, sort of aptitude and desire to know and understand data. But if other folks are not meeting at that space, it doesn't make as much sense. At the end of the line, though, they are, as a development, officer, often responsible, though, for volume. And so those questions still relate to the value of this exercise, because then they may be able to see more clearly why this makes sense to them.
Yeah.
What value it might have.
Totally. It's interesting because again, you see this across sectors too. It's where the budget sits, and it almost never sits in marketing, oddly. It sits elsewhere. And so there is this question of like, there's a lot of things we want to go do. Why is this going to make sense relative to a million other things we could choose to do? One of the things we've also found, which is fascinating as we've talked to people about this, is the amount of fixed costs. I mean, you said it earlier, even to provide care, the amount of fixed costs is enormous.
Right.
And there's the utilization component of this, which is easy to sort of, it's not dissimilar to, cost to acquire a patient, which is like, well, it is what it is. It's like, well, no, it isn't. I mean, it's same with utilization. You're like, well, I don't know, our utilization is X. And, the leverage you get from high utilization rates and from, is enormous. And so particularly if you have a larger organization across multiple locations, and you can end up with this, the coordination between what's happening in the marketing teams and what's happening at the locations and being able to see that. So for instance, it just doesn't help. I mean, it's almost, it's worse than, forget about the money. You convince one more person that they really should come in and you don't have a bed for them. I mean, that's terrible, right? So the ability to be able to organize and be able to place your bets such that you're going to drive utilization is an enormous impact in terms of ROI. And those two things working together is really powerful because now they can be coordinated.
Yeah, absolutely. And we get the early indicators because we have lengths of stay that generally average out depending on levels of care. So we kind of know our patient journey and the volume and how it's going to pull through. Therefore, when we might have additional capacity, or we've been tracking low for a while, so we need to sort of double click into that region and do a task force that sort of reaches out and makes sure that we're capturing the patients who need care there, especially because folks who finally decide to come to get behavioral health care, they don't tolerate waiting very long because that engagement can be fleeting. It's not like you have a medical, prognosis that needs, a procedure done, and then you're one and done, and you go, and you're sort of waiting in a queue. The mental wherewithal to sort of engage in treatment is its own journey. And then, you want to be responsive. You want to meet the patient where they are. You want to join with them and then bring them in so that you can help them along their journey in a very timely way. So you're exactly correct. That is a big challenge for us is optimizing our utilization across our service line and across all our centers.
Have you found the integrated data system that you guys are using now allows you to coordinate what's happening in marketing and drive utilization?
Yeah. So what we were able to do, for instance, at different times last year was to drive regional campaigns and spend preemptively to increase awareness, to increase engagement on our website. And so we did. We have tried, and some have worked. I mean, to be honest, some have worked and some haven't.
Right.
But we actually had reason to believe that we should drive this particular campaign in this way for this line of service or this level of care in this region because we would have capacity, and or we were standing up a new program. Right. We were standing up a new clinical intervention, and we wanted to drive awareness. And so it was a very effective tool to support our efforts in being more surgical instead of that one size fits all. Again, when I started, we had a bit more of a broad approach. And I kept asking, wait, where's this regional campaign? Where's this regional, tactical approach that we're going to take with these providers? And we just didn't have that. And in the last year and a half, the team has really become much more agile and regionally responsive, in part informed by how we're using our data.
Right. One thing that you say, and I just want to, call it out because it's such a huge thing and across everything, is actually things that are not working and knowing it is arguably as valuable as things that are working because you waste money. Like if you don't know and you can't shut it down and say, okay, what did we get out of this? I mean, hopefully it should have a learning agenda, but if you have data, you can start to see patterns and so on. But like, it's so critical because if you can't see that, then you can't do anything.
No, and you repeat mistakes. In fact, I meant to mention that earlier when we were talking about spend and the ability to sort of justify is the wrong word, but for lack of a better word, we'll say justify the spend. Equally valuable was our lesson last year in that we had sort of maxed out the benefit of a certain spend. And so it was interesting because just this morning in our Tuesday 8:15 call, we were having a conversation about what was different last year. We're seeing this year. And we were able to say, yes, but we, recognized at this time that we maxed the spend based on these locations. So we aren't going to repeat that this year. That's hugely valuable.
Right. And it's, at this scale, that's a lot of money, right? I mean, it's
yes,
it's a lot of money. And so and that kind of goes quietly right in the pocket to be able to do the next group of things.
Right.
So let's talk a little bit about what you see coming. It's and obviously there's, a lot of different places to take this, but, when you think about like a 5 or 10 year time horizon, or even, and actually things are changing so fast, maybe we could start with what you think will happen over the next couple of years. What do you think the future holds for behavioral health, and what are the mechanisms that you're thinking about to be able to make ERC successful, but also in the industry? How do we get more care in the hands of folks, and how do we think about, what do you think the cutting edge of the state of the art is?
It's a little bit of an old and tired topic. We need mental health parity. I mean, in the behavioral health world, we spend this time right now talking about investments, and we're talking about providers, and we're talking about shortages. And I don't want to be, polarizing, but we need, our insurance industry and our government to recognize the true cost of providing behavioral health care, mental health care. And we need parity with the rest of the healthcare market, because we aren't employing or making widgets. We aren't employing, line workers here. We are, and not that there's anything wrong with that at all. It's just we have the requirements of what we do require people who have advanced degrees, who are licensed professionals, who are prescribers, and there is a shortage of all of those. And our payer mix determines the viability of our business model. Whether you're for profit or not, either way, you still have to answer to someone and you still have to keep the lights on. And so the ability to do so requires folks to actually implement, laws that were put into place around parity, and that will allow the industry to service the people who need care. And then we need people to continue to become psychiatrists and nurses and therapists. And, we need to make that opportunity and that experience affordable. And so that these folks aren't graduating with, mountains of debt to where it becomes, a non-starter for so many people. So it needs to be accessible to continue to do what we're doing. And again, I'm not in trying to be provocative, but that really is in the next 5 to 10 years. We're coming to a tipping point, because what you're hearing more and more is the stigma that has previously plagued and kind of kept mental health tucked away quietly and tidily in the corner is thankfully being released, and people are more brave, and they are owning where they are. They're owning their challenges, and I celebrate that, and I congratulate folks for how brave it is to do that. And so we have more people who need care, and we don't have good quality, consistent care available across the country, and we don't have the financial infrastructure to fund that, private or publicly, to support it. And so that really is the most critical change, is we kind of need to, instead of competing, and again, this is the idealistic social worker, so I recognize that, but linking together using a common data set that tells us these are the amount of lives that we are not able to help, and joining together to at least share the responsibility to fight the good fight. That's what needs to change. I mean, that's what needs to happen.
Totally. Well, and I don't think that's the goal, and that's not idealistic. That's what's required. These are our, these are our family and our friends and people in our community. So, no, that totally makes a lot of sense. And I think, something you mentioned, which, has certainly gotten better in my lifetime, is the stigma around, a lot of these disorders is dissipating. Not always, but it's better. And that's a huge thing, and there's some comfort in, in the 50s, no one would talk about cancer. Right. And and even, but I remember, I don't know, in the 90s, you would never say you were depressed.
Right.
Wouldn't do it.
Right.
And in fact, there were all these people walking around. There was no mechanism for people even knowing what the, even if you knew, you didn't know, right? You just you found your way through. So I think in that sense, that's a foundation. And I think your comment about adding data so people can start to get a sense of the numbers, because people understand the individual suffering, right? I mean, we all know somebody who's had these challenges,
right.
And it's horrific. So I think that's exactly right. That makes good sense. And I think, the other piece to this is we have to be able to get the right infrastructure in place. And then we got to figure out a way to be able to reach these people and help to encourage them to come and get help.
Right. Exactly.
Lydia, thank you so much for joining us. This was spectacular. And it's always, this has really been fun for me, because one of the things that we always try to do in our other business, not the All Thoughts Connected, is we love to work with people who have a mission, right? I don't know, you look back and the work you guys are doing is so inspiring, really. So thank you for that.
Well, you've been a great partner.
Well, we do our little, in our little corner, we do our best.